And welcome to the Nutrimedical Report, and I want to go through some of the wellness conditions and some of the different top nutraceuticals. And I think it's important people understand that when we talk about Nutrimedical products, they're superior for a number of reasons. The first is that they're doctor level. They're by physicians and research scientists and PhDs, etc., around the world through our academies of anti-aging, environmental advancement, and medicine. So they're not regular nutraceuticals. Number two, they're all in their biologically activated state, which means they're jump over any gene defects or toxic blockades to bioconversion. All of the vitamins from other companies do not have that. All of the minerals are in protein amino acid chelates, which is the top mineral delivery system, not in an ionic form. And they're also bio-delivered, so they deliver them over many hours. So if you take several times a day, you're getting the full dosage that are activating your genes, your enzymes, etc., during the entire day. There are dosages, too, that will have biological effects that are very powerful, and they will substitute and reverse many illnesses and underlying conditions even before you have symptoms. So it's important to understand they can be tailored by a functional medicine history and review, which reviews not only medical information, nutritional information, organic metabolites, toxins, etc. So it involves science. It involves medical science, pathological science, toxicological science. It is not just paint by numbers, crazy vitamins that people are pushing. It also is important to understand when you're taking our nutraceuticals, we can retest with functional medicine, blood, urine, stools, and genetic tests. We can also do bioplasmatic tests like the QRMA or bioplasm, expert and clinical, and we can actually tell you if you're on track or not. We can tell you what kinds of imaging studies that can be done. For example, let's say you have early dementia in your relative. We can look at myelination patterns in the brain from a T1 weighted MRI. We can do a non-invasive test like a quantitative EEG. We can look at organic metabolites. We can do neuropsychological testing. We can do all kinds of tests, including, for example, for pain. We can do what's called an axon 2 nerve pathology scan for A delta and C fibers, and even tell you right down to the individual nerve fiber where you're developing neuropathy, because we look at the A delta and C fibers that are your sensory nerves, and you look at your EMG response to determine exactly where the pain fibers and pain circuits are in your first level. It's called a pain gate, called the Langerhans gate, which I discovered, published, and put in my 1986 patents on the Dynatens, the first morphogenic field therapy machine ever invented. So you need to understand when you're receiving information here at Nutrimedical, it's far superior to any other nutraceuticals anywhere. We don't need to give you any specific names. We just need to tell you they're far superior to nutraceuticals anywhere. So whether it's Cardiovasc, the original formula developed by Sami Rahim, not a knockoff. We tell you about the Lumen Photon. It's not from the Hammacher-Schlemmer catalog. This is the original developed by Dr. Nogier, the French scientist. The most powerful LEDs made right here in New Mexico near the Los Alamos laboratory by top scientists. When we look at Mountain Red Velvet, it's the top nutraceutical in the world in terms of Mountain Red Velvet with 297 biomolecules and 6 growth hormone factors. When we look at the best organic hyperbaric chambers in the world, they are the Summit to C. When we look at all kinds of technologies, indiamines, the indium sulfate, the research on chaperoning minerals into your cells and tissues. When we look at issues such as pure water systems, there is no water system to compare to this. It doesn't remove some of the toxins. It removes 100%. It's cleaner than distilled water. And if you use the code Nutrimed, you save 10% on a whole house system, 300, with a 5-gallon pressure tank, a above-the-counter system, a BEV 100, the whole host system, or a BEV 200 tackle box system you can take out of your truck or car and actually drop a line into a puddle. And without being an energy vampire, it will create water cleaner than distilled without being an energy vampire. We have the quantitative resonant magnetic machine, and we have the original ones developed by Dr. Zhu that actually will give you a quantitative resonant analysis of your biological needs. And you can send me a compressed file anywhere in the world along with your functional medicine history. And again, if you want to get a consult, the consultations are email consults $150, a phone consultation is $300. You need to fill in the 11-page functional medicine history form and additional medical information, x-rays, labs, reports, blood tests, 23andMe, Prometheus analysis of your genetics, organic acids, toxins, anything you want to put in there, I'll analyze. This is not available by other people because they're unqualified. They cannot take your test and tell you if you're on track or not. We have the Silver 100, which is the best ionic silver in the world, 100% in its ionic state, so it kills off pathogens. We have the VibraSlim, the best vibrational platform at the best price with the best service. And it's $1,299 with delivery and a 3-year warranty. We have the best ultra-liquid zeolite. The ultra-liquid zeolite is the only non-acid wash zeolite in the Western world, and combined with their Chelar Max is the best oral chelating agent, and I like it better than IV chelation because it's too hard on your body. You have to give Meyer's cocktail back, and you often miss many minerals. Of course, we have now our donation site for people who want to make charitable donations to veterans and people that don't have money for their nutraceuticals. We have the mild hyperbaric chambers with Bruce McKeeman, and they brought out new chambers. In fact, this year they're certified to bring in chambers that can put a stretcher in there or a wheelchair. They have the only vertical grand dive. Now they've built a new one with 9 inches taller. They have ones that can zip off the entire outside of the chamber so you can slide someone into the chamber on a stretcher. These are amazing devices. In fact, I just had mine serviced and put in a new frame on the inside, and their service is fantastic. We sell the ozone generators to generate ozone. You can ozonate water, either for oral or for rectal ozonated water, if you want to take ozonated enemas. I recommend putting the ozone line into your compressor for your mild hyperbaric chamber. And I have basically a oxygen concentrator, so I can put another 5 to 7% oxygen in the chamber as well. It is amazing for restoring and maintaining your health. We have less EMF, of course, with the electrosmog and radiation detection. In fact, I had a question this morning from a gentleman up in Los Angeles, and he saw the Veterans Today article, and he raised an issue that I want to clarify, because I'm writing a book 5 years in the making with Chris Harris, our nuclear expert, that's a consultant for the Nuclear Regulatory Commission and his colleagues. And I posted over 3.5 years ago specific technical details of how to fix Fukushima Daiichi. And I saw an ENE article the other day that said they don't have a solution to it. I do. I can tell you specifically, exactly, technically what they need to do to fix Fukushima, how to clean up the oceans, and how to help with people to monitor the levels. I recommended more than 3.5 years ago we do USB-connected radiation detectors in all commercial airlines and build a plume map in real time to tell the number of parts per million, and then do air sampling to determine the spectral pattern of the specific isotopes, because many of them have long half-lives and are bioaccumulating in the biosphere. It's radiologically desertifying the northern Pacific Ocean, and part of the reason why here in Southern California we're seeing all these sea lion pups dying is because their food supply is dying because the ocean's being destroyed. Now, they don't want to tell people they're bioaccumulating strontium-90 and cesium-134, 137, and other isotopes. They don't want to tell the people, and they don't want to test. And the federal government is silent, as well as the IAEA, etc. But we can give you individual tests. For example, no more than, I think, 85 kilometers north of us, or roughly 60 miles north of us. One gentleman called me this morning from Los Angeles, and he said, look, my radiation detector just at the start of the March 11th, 5 years ago disaster, radiation levels are 15, 20 counts per minute. Now they're sometimes up to 50 or 60, but it's nowhere near as high as Veterans Today. I contacted Veterans Today. They will not disclose their source of their testing data. They will not answer my questions. They are muddying the water by saying extreme statements when they don't have air sampling levels in the troposphere, because most of the radiation from my research and from many people who contacted me, by the time the air reaches here, the highest level radiations are at 20,000 to 30,000 feet. Yes, there's radiation coming in along the coastal areas in the foam spray that can go up to 100 miles inland, but most of it is actually in the ocean waters. So people need a grasp. There's a lot of disinformation, and people won't answer my questions, and as like I've said, where's my abuse? I do not have people challenging me that are scientists, technicians, and so on, other than ad hominem idiots who want to make statements about me being a crank or whatever. You need to shut up. If you have a question or a statement, make it. Make a scientific statement and a statement of fact rather than conjecture, okay? And welcome back to the Nutrimedical Report, and we're talking about the top 3+ nutraceutical products for specific health conditions. And I'm going to go through some of the protocols so you'll get an idea. When you log on to Nutrimedical and you have an elite membership, you get the top 3 under AAA. You'll also get it on the Dr. U book. If you get the Dr. U book, it explains functional medicine, explains the QRMA, and it explains how you can learn how to say no to doctors that are doing things that are inappropriate. I'll start off with some of the simple things. Acne. Now, what acne is infection of the sebaceous glands, so you want to start off washing your face with a neutral soap. Then I recommend Silver 100 spray to the regions, the anti-inflammatory creams, pregnenolone and curcumin, and then the use of Allicin Med orally and Nutridyne. Attention deficit disorder. The first thing you want to do is reduce what's called a brain on fire, Cognition Plus, 2 capsules twice a day for an adult and a smaller dosage for a smaller person. You can make a smoothie. Brain Power, at least a capsule twice a day to reduce vinpocetine to reduce brain inflammation. BioLVR for neurological recovery. And if you want to add additional things for cholinergic pathways, we recommend a triad of CDP choline or cytidine choline, uridine monophosphate, and ultrathymine B1. And for myelination, if there's delayed myelination caused by the chronic BOF, which will delay myelination, Neurogen and cell detox glutathione. The Neurogen will help remyelination. The cell detox glutathione will stop peroxynitrate and hydroperoxy radical. Adrenal and thyroid support. Your adrenal gland, first adrenal gland support, 1 to 2 capsules twice a day. Very often you'll see thyroid deficiency too, so if you look at the QRMA or do testing of free T4, free T3, free reverse T3, and TSH, if the RT3 is high, it doesn't matter if your T4 and T3 are normal, it will block thyroid function in your mitochondria by directly blocking the crista galli of the mitochondria, so your core body temperature will be low. So if you do a core body temperature test, first thing in the morning before your muscle twitching or brown fat generates heat, you'll actually see the core body temperature below normal. I recommend with adrenals, DHEA 1 to 3 pumps on the upper abdomen and pregnenolone 1 to 3 pumps in the upper abdomen for adrenal support. For hyperactivity, adrenal hyperactivity, we recommend Calm Mind and Brain Mag, 1 to 2 scoops in filtered water 3 times a day, Posinol, 2 soft gels 3 times a day, Cell Defense, 2 caplets 3 times a day, and you can add other things like Regenerex. Adrenal hypofunction, of course, we talked about this already. Agent Orange, Xenoestrogen Detox, 2 capsules twice a day, and NutriDefense, 2 capsules 3 times a day, BioLVR, 2 capsules 3 times a day, and also for methylation pathway support, SAM-ethyl, which help methylate out, and Life Support. Life Support supports glucuronidation, sulfation, and methylation pathways for phase 2 detox. AIDS, HIV recovery, and you can measure the viral load. Nutriodine, 20 to 30 drops in water 3 times a day, and you have to work up slowly because the first start you're going to get a detox reaction. Allicin Med, 2 capsules 3 times a day, and NutriDefense. And you can add Silver 100, 1 spray or 2 sprays or 3 to 6 drops per 10 pounds body weight. And that will kill off the AIDS virus, and actually it's an intracellular RNA virus. You also monitor the CD4 cell count, see it return to normal. So if you look at viral load, you can actually see it whether it's hepatitis C or AIDS or some other pathogen, including anaerobic bacteria in the lower gut, it'll normalize. And oftentimes, you don't just get AIDS, you get a massive overgrowth of fungi and yeast in the body, mycobacteria, and viruses, including spirochetes like Lyme or babesiosis. So a person that has an AIDS syndrome has multiple copathogens present in their body. Alcohol and drug withdrawal, Calm Mind and Brain Mag, 1 to 2 scoops 4 times a day, BioLVR, very important to rescue with activated B6, B12, and folic acid. Cognition Plus, 2 capsules, 2 to 3 times a day, and Brain Power. And you can also use the little brother of Cognition Plus, Synaptin. Alkalinization of the body. If your QRMA shows your body is acid, or if you do a urine test and find you're extremely acid, Power C Plus, 3 to 6 capsules 3 times a day, NutriComplete, 1 to 2 scoops 3 times a day, and full vitamin K2 for reversing that 2 capsules 3 times a day. Allergies. We have Allergon, which is the actual first and only enzyme that's capable of actually getting rid of histamine, both allergic allergies from inhalants, foods, etc., and from contactants. Allergon, 1 to 2 capsules 3 times a day. It's an actual histaminase. Allerblock, 1 to 2 capsules 3 times a day. And GastroHeal, chew 1 to 2 tablets 4 times a day, will help to heal the gut wall. And the Allerblock, and of course you can add Power C Plus to stabilize the membranes, and Cell Detox Glutathione, which will also stop the free radicals as well. The next, of course, is Inhalant allergies. We talked about Allergon and Allerblock. You can use also Silver 100 nasal spray, the vertical nasal spray in the nose, and inhalant spray. And one spray per 10 pounds body weight will have a dramatic effect of reducing inhalant allergies in the sinuses. And I also recommend a Sinupulse Elite with 20 to 30 drops of Nutridyne in the chamber, which is 800 mils. That gives you irrigations, 200 mils per side, 4 times a day, and that will get rid of we call sinusitis and allergens, because there's often co-pathogens present, viruses, bacteria, mycobacteria, and fungi. Alopecia totalis, that's loss of hair. Collagen Max, a capsule twice a day. Recidival hair tonic, and this works for both males and females. When you see females, especially postmenopausal or post-traumatic stress, their levels of adrenal sterols and male-like hormones are causing senescence of, because they're activating male receptors in the hair follicle and turning the hair follicle into a senescent state. So recidival hair tonic at least twice a day, and Mountain Red Velvet, one capsule opened under the tongue 3 to 4 times a day. And that'll help reverse the alopecia totalis. Amyotrophic lateral sclerosis, again, remember Cognition Plus, 2 capsules 3 times a day. Brain Power, a capsule 3 times a day. And Neurogen, 4 capsules twice a day. And to stop the free radical reactions, we have Nutri-Trala, long-acting alpha-lipoic acid, cell detox glutathione, the only acetylated form of glutathione available anywhere. And we also have, of course, Regenerex to actually activate the genes, the PGC1 alpha and other antioxidant enzyme systems. So that'll help to reduce the inflammation. You also want to bind the free iron, the Fenton reaction. You want to use NutriDefense. NutriDefense will actually block the free iron and the Fenton reaction, which is essential for amyotrophic lateral sclerosis and the loss of the secondary motor neuron in the anterior horn cell. Alzheimer's. Cognition Plus, this is the top 3. Brain Power, Brain Mag, very important for brain protection with magnesium L-threonate. We can add, of course, for myelination patterns, if a T1-weighted MRI shows delayed myelination, or BOF, we can apply the other things for acetylcholine like CDP choline, uridine monophosphate, and ultrathymine B1. And for microcirculation of the brain, because there are often circulatory issues, we use ellagic acid, cardiovasc, and omega supreme krill. Very important to stop the astaxanthin. Our krill has 2,000 micrograms compared to mega reds out there that are commercially advertised all over the magazines and TV. Theirs has 117 micrograms. Ours has 2,000 of astaxanthin. No comparison. When we come back, we'll talk about more protocols. And your questions, 800-2595, Top Nutraceuticals. Amyotrophic lateral sclerosis we talked about. We have acute macular degeneration, Vision Max. Very important nutraceutical, 1 capsule twice a day. Neurogen for myelination of the optic nerve head. Can-C eye drops, which is dimethylcarnosine developed by Dr. Babachev, 1 drop to each eye 4 times a day. Also, I recommend cell detox glutathione, and Neurogen, of course, works together with that, and the use of Nutri-Trala, because you're going to stop the free radical reactions in the back of the eye. The cell detox glutathione is extremely important for eye inflammation disorders. I also recommend the Lumen Photon, setting number 7 for lowering intraocular pressure, and for stimulating the back of the eye, setting number 3 for neuroectoderm tissue, such as the skin and the neuroectoderm of the central and peripheral nervous system. Anemia. We have, of course, ferritin, which is the iron 3 from beef spleen, a capsule twice a day with Power C Plus or citrus juice. BioLVR, which is going to include the activated B6, B12, and folic acid. You can also take superfolate and Powermethyl B12, the superfolate twice a day, a capsule. Powermethyl B12, a tablet, orange flavored under the tongue. And then 3, Mountain Red Velvet for general support. Open 1 capsule under the tongue 3 to 4 times a day for anemia. Angioedema. This is where you get, swelling in different parts of the body. Cell Defense, 2 caplets 3 times a day. Allergon to stop the release of histamine, 2 capsules 3 times a day. Power C Plus, 3 to 6 capsules 3 times a day. And, of course, I recommend cell detox glutathione and Nutri-Trala to stop free radicals, and Regenerex. Ankle instability and joint arthritis. You can have the same thing with wrist instability or joints elsewhere in the body like shoulder instability or imbalances or tendinitis. Tendon Mender, 2 capsules twice a day. Joint Performance, 2 capsules twice a day. And then Collagen Max, a capsule twice a day. The tendon mender actually modifies the tenocytes to normalize the healing of tendons and ligaments, stop tenosynovitis. Joint Performance will help to rebuild the cartilage along with Mountain Red Velvet and Collagen Max. It triples the rate of the proline transhydroxylase. And then Mountain Red Velvet and calcium under the tongue. And for rebuilding the cartilage of joints, etc., Samethyl helps to improve the rebuilding of the cartilage with 1 sachet under the tongue twice a day. Anosmia. And we're updating this protocol. Anosmia is a loss of smell. BioLVR, 1 capsule 3 times a day. Cognition Plus, 2 capsules twice a day. And then Nutrimedical, usually with a Sinupulse Elite to deal with low-grade infections in the sinus cavities. You can also add the use of Samethyl for methylation pathways to improve myelination, because methylation is necessary for remyelinating the olfactory nerves and the cribriform plate in the top of the sinus cavities. And you can use, of course, with that, power-methyl B12 and superfolate. And Neurogen, which is docosahexaenoic acid, which is necessary for remyelination. Anti-aging rejuvenation. We talk about this as just general. Microdose, high dose, 5 sprays under the tongue, morning and bedtime and before exercise. Collagen Max, a capsule twice a day. Mountain Red Velvet, a capsule under the tongue 4 times a day. And then Myco D2, which is the mushroom-based Myco D2 with ergothioneine, which is the first receptor activated for stem cell regeneration. Anxiety and panic disorder. Calm Mind, 2 scoops, and Brain Mag, 2 scoops in filtered water 4 times a day. We have, of course, Posinol 2 soft gels 3 times a day, and BioLVR capsules 3 times a day, and that'll help to reverse anxiety attacks. We also recommended sleep time, the melatonin TR 1 to 3 tablets, bedtime an hour before planned sleep, because a lot of times if you sleep properly, anxiety attacks are much less during the day. Arthritis. Inflamex, which is the old Wobenzyme N formula, but 10 times stronger. It also contains the serapeptase silkworm enzyme, 4 to 5 capsules, 2 to 3 times a day. Joint Performance, 2 capsules, 3 times a day. Twice to 3 times a day. Tendon Mender, 2 capsules, 2 to 3 times a day for arthritis. And Samethyl, under the tongue, twice a day for surfacing the joint surfaces as well, along with the Mountain Red Velvet. Asperger's autism syndrome. Asperger's and autism. Asperger's is high-functioning, socially inappropriate, and autism where the intelligence is delayed. Cognition Plus, 2 capsules 3 times a day. CDP choline, we mentioned earlier, which is to increase cholinergic levels of acetylcholine in the brain, in the cingulate gyrus and the hippocampus area that records memories and learning. Ultrathiamine B1, 1 to 2 capsules twice a day, and uridine monophosphate. And to reduce brain inflammation, we recommend cell detox, glutathione, Regenerex, and Nutritrella. And the most important of those is the cell detox, glutathione, and Regenerex. Asthma and bronchitis. Recommend Silver 100 sprays, sets of 3. You inhale 3 sprays, hold it for a count of 10. Repeat to a dosage of 1 spray per 10 pounds body weight. Nutrimedical, 15 drops in water 3 times a day, orally. Cell detox, glutathione, 1 to 2 capsules. And you can actually open up a capsule of glutathione and either put it in with saline in a Omron or a Sinupulse Elite with a clear blue capsule to inhale to reduce the lung inflammation. You can also add Allicin Med, Alamax or Alamed to kill off the pathogens. There's also multiple copathogens in the basket cells in the bronchi that cause asthma and bronchitic illnesses. So it's not just a sterile situation. In fact, they've discovered rhinovirus subclass 3 present. Ataxia telangiectasia wellness protocol. This is a neurological syndrome where Cognition Plus will help. Neurogen and Venaway for the microcirculation in the brain. We also can add ellagic acid and Cardiovasc, which is very important for the endothelium of the small vessels in the brain. Autoimmune conditions. And we use the same protocol we do for cancer, basically, which is Maligna Rest, a packet twice a day, Power C Plus, 6 capsules to 9 capsules 3 times a day, Nutrimune immunoglobulins, 4 capsules twice a day. We also can add other nutraceuticals such as ellagic acid, Maligna Block, and full vitamin K2. And what we do is we put the person on a ketogenic diet and recommend mild hyperbaric oxygen and get the person in an alkaline state with a high-dose Power C. It's amazing how we can actually turn off autoimmune disease when we get rid of also the copathogens present in their body, such as stealth fungi, mycobacteria, etc., For example, we now know that spirochetes such as Lyme or babesiosis trigger off MS and ALS and so on. They're not just a sterile condition, they're a stealth infection triggering off a Fenton reaction and a free radical reaction causing nerve cell death. Alcohol, liver disease, Nutrifos for regenerating the liver tissue, BioLVR for detoxification, Minerals Plus necessary for the healing of the liver, and Cell Defense anti-inflammatory for liver regeneration. And of course you can use MycoD2 with ergothioneine, mountain red velvet, etc. for regeneration of the tissue. Lou Gehrig's disease, amyotrophic lateral sclerosis. We also mentioned with chronic fatigue syndrome, besides the ones we mentioned already, NutriDefense that stops the Fenton reaction in the ALS, Narival, 1 to 2 capsules 3 times a day, CDP choline and cell detox glutathione. You want to restore with ultrathymine B1 and uridine monophosphate cholinergic pathways because it's a cholinergic disorder in the anterior horn cell in the spinal cord. We look at back pain. Again, Anflamex, topical curcumin, and pregnenolone to the back, tendon mender and joint performance, and mountain red velvet. Bad breath, believe it or not, is periodontal disease. Brush your teeth with Silver 100. Get a hydrofloss and floss with Nutriodine. It changes the charge of the plaque on your teeth and pulls it off. Allicin Med, a capsule 3 times a day, and no more bad breath. Bell's palsy, the motor nerve to the face, Cognition Plus, Cell Defense, and Neurogen for remyelination of the nerve, and also cell detox glutathione, and Nutritrella and Regenerex. Beta thalassemia, which is pretty common for people from the Mediterranean, ferritin, BioLVR, and superfolate will help to reverse a lot of the effects of the beta thalassemia, anemia. Bipolar depression, BioLVR reverses the neurotransmitter problems, Narival, which is acetyltyrosine, and the use of Indiamines, along with to reverse that issue. So when we come back, we'll continue going through some of the 1, 2, 3 protocols. Coming up in hour number 3, Chris Harris, our nuclear expert, has an update, and Tim Alexander. And we will be back in just a few moments. If you have any questions on the health issue or geopolitical issue with the Trump campaign, post back, and we get all kinds of interesting requests. Bladder spasticity, irritability. In females, it's often a trigonitis where the lower bladder is inflamed from infections like ureaplasma or E. coli, etc. We recommend, of course, the antipathogenics, Allicin Med, Silver 100, Nutriodine, and NutriDefense. But then you want to reduce the neurological irritability of the bladder, and in males, it's often the prostate pressing against it or low-grade prostatism. Swedish flower pollen, 1 to 2 tablets, 4 times a day. It's a natural alpha-1 blocker that doesn't have all the nasty side effects of blurred vision or dry mouth. Bladder Up, which is a pump-in seed